Not a neuroscientist or anything. There is misinformation going on out there that Suboxone is not addictive. It is. What the hell does that mean, all right? There is no evidence that a long-term taper or long-term maintenance, like being on it 4 years, increases your chances of staying clean. I am here presenting fact, scientific data. Not a neuroscientist or anything, but I want you to ask them one question. Why don't you quit? They do not have the science to back that up. Basically, not a neuroscientist or anything. Personally, and again, I am not a doctor, but I'm actually somebody who quit cold turkey, and it wasn't by choice. This was something that happened to me because I lied, because I was trying to be cool, and I didn't even want to get clean and sober. I was trying to make them think that my addiction wasn't that bad so I can go back and relapse later. What the hell does that mean, all right?
I thought that I've always been pretty good at finding the truth. So did I make a good entrance? However, I am surprised that an individual is still being taken seriously. I have been on multiple medications for pain management. Whenever I was first prescribed these medications, I didn't know anything about them. I didn't know the dangers, the risks, the side effects, and how they worked, and then the inevitable pain whenever I no longer had them. So to address what I think is one of the most important things, especially in what has struck such a nerve with me, and to debunk something that has been perpetuated, there seems to be this belief that Suboxone or other medicated maintenance assist therapies is some sort of one size fits all. It is foolish to think that everyone's journey to recovery or rehabilitation or to just simply wellness is going to be the same when we had completely different paths to get us to where we are or to get us to where we were. Full transparency, I have a slipped disc in my jaw and a dislocated jaw. This means that I have a 24/7 vice grip headache. Because it's lasted for over 12 years, I've pretty much gotten used to it. However, I have constant vertigo, my jaw will pop, and I will be in immense pain. Whenever this first started happening, though, is whenever I went and saw a pain management specialist. That is when I got introduced to all of the following things I'm about to tell you about. Because in order to understand why the suggested advice given is so dangerous, we need to understand how these things work. I want to make it clear that the information being presented here is for anyone that is struggling in some capacity with opioid dependence, addiction, tolerance, abuse, whether it's through recreational usage, whether it's because you were a pain management patient and now are addicted and dependent upon the medications. Maybe you have moved on to other opiates that are illicit, streetwise, etc. Or if you're an individual that is struggling with pain management and want to seek other solutions to see what else is possible for you. There are plenty of options that are out there and they're different for everybody. But what's important is that you are honest with yourself, with your doctor, and that you find proper treatment, that you find a doctor that is willing to have a conversation with you and to explain the options that are available. Oh, here's some science. How do opioids work and what are they? For the sake of time, effort, and energy, I'm going to be focusing on how they are derived and made into medications used for pain or otherwise, and also how they become addictive. Opiates were originally derived from the poppy plant. We then noticed that they provided pain-relieving effects. The part of the brain in which the opioids work on includes the thalamus, hypothalamus, and more specifically, the ventral tegmental area, or what is known as the VTA. This is where you could say all the fun stuff happens. Our brain is actually capable of making our own opiates as a response to pain. However, we can interrupt this process by utilizing external opioids, or what is known as exogenous opioids, in order to manage pain ourselves. When an opioid such as morphine binds to these receptors, that's when we experience the relief of pain. However, another action that happens is that the inhibitory neurons release dopamine, which acts as a reward. We typically release dopamine naturally through exercise, eating, sex, but ultimately, overuse or excess use of opioids will result in a lot of dopamine being released. However, aside from the pain relieving effects, opioids also have some side effects. Then they also affect the heart rate, as well as the respiratory system. Some unpleasant side effects include nausea, feeling overly tired and sleepy, and some unpleasant gastrointestinal issues. Opiate medication you've probably heard of: Lortab, hydrocodone, oxycodone, Oxycontin, and even much stronger things such as morphine, Dilaudid, and fentanyl. People can become addicted and even abuse these particular medications. And of course, the more they're used, the more the brain relies on them in order to achieve homeostasis. I'm so much a show don't tell person, I'll let this next clip speak for itself.
Through my body. Any ache or pain or sadness or guilty feeling was completely flushed out.
I can certainly see why that would be appealing. However, over time, addiction absolutely affects the brain. Since the brain becomes dependent on these particular substances to maintain homeostasis, the removal of these substances will disrupt that and lead to what is withdrawal. So out of all of the clips that I could have to show this, these are certainly ones that could be hard to watch, but definitely portray how difficult it is for somebody to get over these particular symptoms, and why addiction, especially that to opioid substances, has such a strong hold on many people's lives.
Day 3 days.
Using words to describe the way I felt whenever I was coming off of pain medication, a decision that I didn't consciously make, but one that happened nonetheless. I was on methadone for pain management without knowing its risks, effects. When I ran out of it, I then had to move overnight, and whenever trying to see a new doctor and showing them my medical records, I was laughed at. When the methadone stopped working, I was in possibly the most pain I have ever experienced in my life. I didn't know what options I had. I didn't know what was possible. But somehow I pulled through. I do not want anyone to feel what I felt. And I certainly don't want them to have the misinformation of how to handle whatever their problem may be, whether it's addiction, dependence, and overall pain. The most supportive thing that we can do is provide people with accurate information and allow them to decide what path they will take. Now that we're done with the depressing bit, we can move on with the explanation, the rebuttal, and also more science that's a bit easier to understand. You see, I was working on a way to be able to describe the following and have it make sense to pretty much anybody. So with that said, I decided to present it in a way that, let's just say, don't give me shit. I did it for you, but follow me on this one. Trust me, it makes sense. It does. A bit of information though before we begin. We're going to be focusing on 3 terms These are the different sorts of medications that are used to treat opioid disorder, opiate overdose, or pain conditions that utilize opioid medications. We'll be focusing on a part of the brain known as what I said before, the VTA, or ventral tegmental area. That's where all the fun happens. And I will be illustrating that quite literally with the best thing I could think of. Welcome to La Chateau VTA. Don't laugh at me. That's me standing on the outside. This is basically my home. I've decided that I want to start having guests over since I'm new in the neighborhood, and I invite some people over. They come around and they seem pretty reasonable. I like them. So they start inviting their friends over. I'm like, oh, well, this is kind of a party. This is more than I expected. This kind of, ooh, like this, dig this. And they're like, well, we know some other people. I'm like, oh, cool, okay. And then, I pretty much become a party house. I was just kind of expecting sort of a soiree or gala event. Eventually it gets to the point where there's a lot of people, more than I knew what to do with. And then so many that I didn't realize that some of my things were missing. Where's my computer? Bro. Then when I start realizing this and my landlord's called, a lot of them bolt. Some hang around though, because, people that are willing to steal your computer are probably going to have other people that are just a burden, so they hang around. It's really depressing to look at. Eventually, I kick them all out. They're gone. I don't want them around anymore. And La Chateau has fallen on hard times. I do want people around though, so I decided to invite some people over that were supportive. Ultimately, we're able to keep these other individuals out. They start helping me put things back together while not feeling absolutely shitty while doing it. It seems that I do a lot better whenever I have a bit more of them. I acclimate to having a good set group of friends. These friends, though, they have bodyguards. These bodyguards help prevent the hooligans from coming back in, because we really don't want that. I'm happy with where things are going. I want to have a gala event. You will not stop my soiree. Actually, these people were so helpful that they went as far as to get me a new computer. They got me one of those gaming chairs. And actually, their friends that they had around, they're able to keep out the really terrible people. I start feeling a lot better and realize that I can keep this on my own. Those people then start to help me get back on my feet, to help me realize that, yes, I can have a soiree when I want, and to recognize what is good for me and what isn't, especially that purple chair. Trust me when I say that I've been using Photoshop for 20 years. Essentially, the red people that were coming in were opiate agonists. Those bind to receptors. And as I described in it, the more and more came in, it started to seem like a fun party. But then eventually it just kind of got out of hand and you were still having to sort of maintain it. And, it starts to manipulate what's going on, such as, things disappearing since a lot in the brain becomes weakened. There are two theories to what happens exactly, whether there are less receptors or whether the receptors are weaker. We're not quite sure yet on this. However, whenever they leave, there is a lot of feelings of dysphoria, and then that's when the withdrawal sets in. Whenever there were little pink people in there, that was essentially what would be called a partial agonist. So this starts to bind to receptors again and help repair the brain, since, this sort of damage cannot be repaired overnight. It has to reacclimate itself to be able to achieve homeostasis. Now, the people that were assisting them, I forget whatever, they were the bodyguards, so to speak, those were opioid antagonists. They essentially keep opiate out so that they can't bind to receptors. And I'll give an example with later information of how these two things can combine for being very effective for some people. But either way, there are a few different ways to be able to handle this situation. Whether one doesn't have a party that gets tremendously out of hand, or whether one just runs a crack house or opioid house. It all is going to repair itself in different ways based on the situation that happens, which is my main point of argument, that everyone's case is completely different. So because of that, the method of treatment is going to be completely different. Every situation has to be evaluated differently in order to properly treat it and to yield the best result. So next we're going to look over what those options are. And remember that whatever option you decide to use, as long as you are taking steps towards improving your life and supporting your greatness, that's all that matters. It's important to know what options are out there and understand how they work, because as we've seen, some people will provide you with misinformation. One of the oldest treatment options for opioid dependency is methadone. Methadone is a full opioid agonist. However, its ability to elicit feelings of euphoria are quite limited. Methadone is typically dispensed at clinics where patients can be overseen and their dosages monitored. While they are attending these clinics, they're usually required to attend meetings of some sort. Depending on the clinic, they may require different things, and there have even been some clinics that require very little, depending on their economic access. Since the induction of Suboxone or buprenorphine, though, methadone has fallen out of favor as the preferred method of treatment. So, what is Suboxone? Suboxone is a combination of two different medications, buprenorphine and naloxone. We'll get to what naloxone is later, but this is a very important part of what Suboxone is. Buprenorphine by itself is called Subutex. This is used to mostly treat chronic pain conditions. Buprenorphine has a ceiling effect, meaning that you can't take more and potentially get a higher effect. The objective of this particular medication is to decrease the need for wanting to feel the emotional high that opioids typically elicit. Buprenorphine is a partial opioid agonist, meaning that it binds to receptors in a different way. People that are receiving this form of medication-assisted treatment tend to receive Suboxone in its sublingual film. This is done so that it is difficult to use it in other methods in an attempt to get high. With both of the forms of treatments that I have just discussed, the ultimate objective is to taper down over an extended period of time. This period of time is determined by the practitioner, and it is based on what is most effective for the patient. The second ingredient in Suboxone, naloxone, is an opioid antagonist. What it does is it kicks all opioids out of your system. The name brand Narcan is what is used whenever somebody has overdosed on opioids. Keep in mind that this medication, along with the following one, cannot be utilized while somebody is still opioid dependent. If it is utilized, it will immediately put them into opioid withdrawal, which is obviously quite unpleasant. This brings us to naltrexone, aka Vivitrol. This is typically administered intramuscularly, aka a shot, and prevents opiates from binding to receptors. In order for this to be effective, one has to have opiates completely out of their system. Naltrexone is not effective on an opioid-dependent person. It also has the form of an implant. However, the concern with Vivitrol is that the cost of it is, for lack of a better word, astounding. The once monthly shot can cost upwards of $1,500. Compared to other methods of medically assisted treatment, this is by far the most expensive one. So now we have the information, a lot of information, and I'm sure this is the part that you guys have been waiting for, and I appreciate your patience. So now it is time to dismantle the statements that dear old Chris Boutte made. Let's tackle the first one.
It is a myth that opioid withdrawal cannot kill you, okay?
What he's referring to here are the amount of people that are incarcerated or in other sort of housing situations and that aren't receiving some kind of minimalistic treatment. Now, the avoidable deaths that he is talking about here are people that are dying from dehydration, hypernatremia, which is an elevated level of sodium in the blood. And with that left untreated can result in heart failure. Now, the thing that he left out is the fact that pre-existing conditions greatly determine whether one is going to have an easier withdrawal or one that is potentially fatal. Usually, if somebody is monitored during withdrawal, as long as their vitals are checked, they're typically fine and that they can retain fluids. However, if you have congestive heart failure or any issue with your heart, yeah, likelihood that it could potentially kill you.
When I got clean almost 7 years ago, I had congestive heart failure, okay? So when you take increased blood pressure and heart rate with heart issues, luckily because the doctors were treating my congestive heart failure, I was 26 years old, and when they released me from the cardiac critical care unit, I must have been on like 8 to 10 heart medications. While the actual symptoms of opioid withdrawal cannot kill you, the other damage you have done to your body can kill you.
Actually, it's the exact opposite of what Chris said that is true. What can kill a person during opiate withdrawal is persistent vomiting and diarrhea, which leads to dehydration, and as I mentioned before, hyponatremia, which is the elevated blood sodium level. These deaths are preventable and are typically attributed to cases of neglect. With intravenous rehydration and some form of observation, patients are generally fine. If you go through opiate withdrawal cold turkey and you're at least being monitored and there is no medicinal interference whatsoever, you're not gonna die. It might feel like it, but you're not gonna die. Actually, whenever I was withdrawing from methadone, my blood pressure got to 84/45 and my pulse went up to 155. I have such a good heart.
Personally, and again, I am not a doctor, Suboxone is not an opioid. What it's doing is it's tricking the brain.
Suboxone is a partial opioid. Actually, I told you about that. I put it in your comments on one of your first videos and you deleted it, I believe. But then you corrected yourself later. You're welcome.
Like this says, the drug can be snorted or injected to get high.
You're talking about Subutex. Subutex is a completely different thing. Suboxone, on the other hand, whenever it's administered to those that are in recovery from drug addiction, comes in what is essentially a large piece of confetti. If you have found a person that actually has snorted that, you win.
Don't know, there was another medication called naltrexone. There's also a shot called Vivitrol. Basically what it does is it helps to reduce craving. There is no dependence or withdrawal from that medication.
Which, sure, Vivitrol could be an option for some people. People who are fucking loaded. Good God, that shit is expensive. Not only that, you have to already be off of opiate completely before you start using naltrexone, aka Vivitrol, in any form whatsoever. So for people that are having a hard time with the withdrawal or don't have a shit ton of money, not a viable option.
So he gave me, I can't remember, I think it was about 10 milligrams of Suboxone about an hour before he did the little procedure, and I got high as balls.
That's because he gave you too high of a dose. That's not meant for people who are not opiate dependent.
So for anybody out there who is saying that Suboxone is not addictive, if anybody is on a long-term taper, I want you to ask them one question. Why don't you quit?
Because if they quit at that time, there's a less likely chance that they're probably going to stay sober. You see, Suboxone is something that is utilized because a person may still have cravings, and that medication is what's helping them stay off of that while they work on the issues that got them into using in the first place. So people need different amounts of time in order to use that particular drug, whether it be 3 to 6 months, whether it be up to a year. It depends entirely on their doctor.
And again, I am not a doctor. Everybody try Suboxone for a short-term taper to help with the withdrawals and begin your recovery journey. Recommendation of pretty much any accredited addiction treatment center out there is short-term Suboxone detox, okay? And typically what that means is 1 to 2 weeks, and it is a taper. To be on a long-term Suboxone program, or methadone is another one, not only do like the best addiction treatment centers recommend this, if you don't believe me or you don't believe what they're saying, like ask somebody who's done short-term versus long-term Suboxone taper.
So have I been up all night finishing this? Yes, I have. I give a shit about my videos. But what you've just noticed in that whole train of bits of Chris talking is that he's referring to what centers prefer to do. There's a reason for this. Economics. Treatment centers will prefer to do something short-term, while there is certainly the ability to do long-term Suboxone treatment. A facility that's going to keep you there for a short duration of time, they're not going to want to go by that. And while that may have looked like it was more promising in the past, such as the article that you chose to show that was dated in 2011, which by the way was only just 1 year before Florida had its issue with pill mills, and all of them were busted. Now, if we take a look at more recent research, we find that there is something quite a bit different. Actually, and several places say this. Let's have a read.
Is that I've known a lot of people who stay on the medication Suboxone just because they are still getting kind of high. All right? Basically, not a neuroscientist or anything, and it's a major issue. Like, pull your head out of the stand for just 1 second.
Core part of addiction, I came to think, and I believe the evidence suggests, is about not being able to bear to be present in your life. I've been talking about how disconnection is a major driver of addiction. But weird to say it's growing because you think, well, we're the most connected society there's ever been, surely. But I increasingly began to think that the connections we have, we think we have, are like a kind of parody of human connection. If you have a crisis in your life, you'll notice something. It won't be your Twitter followers who come to sit with you. It won't be your Facebook friends who help you turn it round. It'll be your flesh and blood friends who you have deep and nuanced and textured face-to-face relationships with. And trying to do now, and I can't tell you I do it consistently and I can't tell you it's easy, is to say to the addicts in my life that I want to deepen the connection with them, to say to them, I love you whether you're using or you're not. I love you whatever state you're in. And if you need me, I'll come and sit with you because I love you and I don't want you to be alone or to feel alone. And I think the core of that message, you're not alone, we love you, has to be at every level of how we respond to addicts, socially, politically, and individually. For 100 years now, we've been singing war songs about addicts. I think all along we should have been singing love songs to them, because the opposite of addiction is not sobriety. The opposite of addiction is connection.
Do your thing, baby girl.
Please don't call me that. I need an adult.